And of course, we have the Director General of Ghana Health Service, Dr. Patrick Kuma Abuaji. So without wasting much time, let me call on Dr. Patrick Kuma Abuaji to deliver his presentation. Thank you.
Thank you very much, and good afternoon all, and Happy New Year to all. I think this is the first time we're meeting this year. Honorable Minister, Honorable Deputy Minister, we'll just give a brief of, further details of what the Minister has summarized. We will talk about the overview of our current situation, the epidemiological situation of COVID in Ghana, vaccine updates, admissions of COVID-19 cases, and there are key policies that will give further details to you. What is our current situation? We are currently experiencing our fourth wave, and I believe that we've seen a sharp decline, and we hope that to continue like that. The proportion of critical cases are relatively low, even though this is the highest wave we've ever had, with the largest number of people getting infected, but hospitalization and number of deaths are significantly low. All regions have active cases as we speak, unlike what we had in November. We have seen a significant reduction in the active cases in the last 1 week, as the new cases slow down and those who are recovering are increasing. The cases among international arrivals are on downward trend, but even though this is the season that we have the highest number of people testing positive at the airport, sometimes as high as 160 cases. The latest one was about 40, which was yesterday. So that's even, if this happened 3 months ago, would have been a record. But there's also a downward trend on the cases, and the positivity has slightly increased, which means the proportion of people who are testing positive have increased in this current wave. We have so far confirmed 155,242 cases. We've done 2.207 tests with an overall positivity rate of 7%. The total recovery is about 149,623. We have so far recorded 1,364 deaths, even though this last year our ascension was the highest in terms of number of cases. We also experienced the lowest number of deaths compared to the other 3 waves earlier reported. Currently, we have 40 severe cases and 11 are critical. And I must add here that, yes, we are talking about Omicron, but we still have some Delta in the system. So if you look at the next chart, it is the four waves we have. The last one you can see is the highest peak in terms of the number of cases reported on daily basis. And this one was not preceded by the minor wave as usual. So that tells you the significance of this current wave that we are just slowly getting out of. If you look at the next chart, the next graph, you see that the same picture of active cases, and more cases are reported in Accra, Kumasi, and in the more urbanized regions. That's where we have the highest number of cases. We saw a very significant steep rise, next slide, in our active cases, reaching nearly 14,000. But as we speak today, we are just about 6,000, and I think in 20. And so you can see a sharp increase and a sharp decline as expected. And I must say that our active cases variations are going to change based on the new knowledge about active cases. So that means that the recovery time may also start being more sharper than it is as we revert from the old 14 days to a new de-isolation period that we'll talk about. So far, we have tested around 51,000 almost 752,000 arrivals at the airport, with 6,696 positives, without a positivity rate of 0.89%. But the latest version, the latest phase, the positivity was much higher, was crossed 10% and plus. About 41% are females, 49 males, and vaccinated about 80%, and not vaccinated 20%. If you look at the trends, you can see each wave is also analogous to the wave we have in the country, but you can see that the last wave was very, very, very huge. And had it not been some of the measures that were put in place, I think our peak would have been much higher than we currently experience, and it would have been more prolonged than we had now. So at the airport, you can see that in December 2021, we reported 2,383 positives at the airport, compared to the same year in the same December 2020, which was only 393. In January, we have recorded already 1,184. So the airport has increased actually the number of cases. This is the first time that in the monthly aggregation, the second highest cause of positivity after Greater Accra was not Ashanti, but this time with the airport. So which means that if you add the airport to the Accra cases, you can imagine the number of cases produced already alone in Accra. So these are the daily cases at the airport. As you can see, peak and then it started coming down. Now 39 was the latest report. And as I mentioned, the positivity at the airport also saw a very steep rise in this season. That tells you that the proportion of people coming in who are positive was much higher than we have actually seen. I will later on come to the case studies and make a case for vaccination, but let's talk more about the vaccination now. So far, we have received a little over 25 million doses of vaccine. We have distributed about almost 15 million already, and we have currently in stock about 10.5 million doses in stock. The COVAX has contributed 68%. Government of Ghana has purchased about nearly 21% plus, and we have had some bilateral donations accounting to about 10% of the donation. We want to use the opportunity to thank our partners for the support. We are expecting about 1.5 million doses very soon. The date is yet to be announced, and then we also allow. This is in addition to the doses that we have had to hold up so that we can bring them in tranches, not to overwhelm our cold chain facility. So far, 34.8% of the population have received at least one dose, and a little over 16% having been fully vaccinated. The 34.8% is in relation to the targeted 20 million people to be vaccinated. In December, the minister declared a month of vaccination, and in that December month, had it not been the Christmas festivity that curtailed the distribution, but we were able to do about 2.9 million, nearly 3 million doses of vaccine were distributed in December, the first 3 weeks of December. So far in January, as at today, we've done about 1,040,000. We are mentioning the numbers that have been keyed into the system. It is not all the time that the villages are able to enter all the data into the electronic system based on network, and so as and when they get network, they update and the numbers. So you can see 1,040 today. If tomorrow we see 1.5 million, don't be surprised that somebody's manipulating the figure. It is because people have been able to key in the data. We started vaccination of schools way back in December. it was, that is 15 years and above. Most of them were in secondary schools. We've so far done 244,307. It was curtailed first because the students started their examination as soon as we started, and then of course they went on holidays. Now those who have resumed, we'll continue vaccinating them, and we'll keep on giving you updates on the number so far vaccinated. On the regional distribution, you can see that Greater Accra has had about 44.5%. They are the highest of the population that have received at least a dose, and with about 24.3% fully vaccinated. This is followed by, I think, is Bono region with about 43% vaccinated with one dose, and about 19.5% fully vaccinated. Ashanti also comes up with about 42% first dose and 16.6% fully vaccinated. Very soon, as we said, we are, the booster dose have been mentioned, but I'll give further details on it as we go forward. And then we are also planning a national immunization dates for the nation, where there will be 5 days of intensive campaign and vaccination. We need time to do social mobilization, mobilize people, and we are expecting, with the help of the media, more people will know and people will make themselves available to take up this opportunity to vaccinate as many people as possible. I think as we are aware, we've always had some challenges with people are talking about vaccine and effectiveness. And we have always mentioned that the vaccine effectiveness are on 3 levels: getting infected, and also falling sick, and of course dying. Our largest center for COVID is GIDC, so we use that as a measure of some of these things. They run a general outpatient just for COVID out there. And in the period between the 4th July and the 14th of July, they saw about 900 COVID cases were seen at the outpatients. The total unvaccinated was 529, which is about 58.8%. Those partially vaccinated were 10%, and we had 30%, which is about 273 fully vaccinated. But let's look at the next slide. Of the total number who were admitted, they admitted 306 cases. The number that were unvaccinated came up, as you can see the chart, was about 261. Partially vaccinated was 39.8% fully vaccinated. So if you look at those who had mild disease, of those who are positive, you can see that fully vaccinated and partially vaccinated are accounted for about 60%. But if you then move on to those who are moderately ill, you can see that about 80%, 82% were unvaccinated. When it comes to severe, you have a similar number unvaccinated, about 80+% unvaccinated. And then those who were critical, about 98% of those who had critical condition were unvaccinated. So it shows you that the benefit of the vaccine is along the spectrum of the disease condition. Based on all these things, we've had some meetings, we've had further consultations, with ministers' approval, we have come up with a few more changes to our policy that we hope to enhance our fight against COVID. For international arrivals, the new guideline is that Ghanaians and resident foreigners who are partially vaccinated or unvaccinated are exempted from the requirement of full vaccination before traveling to Ghana. However, they'll be offered vaccination on arrival, and if they fail to take the vaccination offer, they go on mandatory quarantine for 7 days at their own cost. So what it means is that the issue of a Ghanaian being denied entry and a resident foreigner coming in because he's unvaccinated will be changed. But when you come in, you have to get vaccinated, failing which you take, you go a mandatory 7-day quarantine. The other cases will be considered case by case. Those who are sick and they cannot get vaccinated, we continue giving exemption for those who come up with those problems and are exempted. And to ensure that cases do not spread, we are going to enhance our home care management to ensure strict compliance with the home management protocols for all those who are eligible for admission. What it means is that we are currently doing some checklists to see those who test positive at the airport who can self-isolate. If you meet that criteria, you are allowed to go and vaccinate, isolate, but we are maintaining a strict program to make sure that you don't really break the quarantine or isolation policy. There's also the issue of de-isolation. Remember, we came up with the 14 days after WHO had given 10 days as the duration for de-isolation. We looked at our own local data and came up with 14 days. We've also looked at further international data. We looked at our own data. We actually tested people who tested positive along the spectrum, day 1, day 2, day 3, until we realized that a certain significant number of people had turned negative after a certain number of days following testing. So for that, all those who test positive and are managed at home will be de-isolated 7 days after testing positive. So which means that if you test positive today, you are not sick, you are just mildly sick, you are able to manage at home, within 7 days, you'll be able to return back to work because first, you are not infectious and you are also fit to work. I think this came up because there was also the change in policy, but of course, some people were also taking advantage of that. For all those who are hospitalized, not those who are in hospital, those who are hospitalized during the period after testing. Let's say you tested positive, you fell ill, you were detained, admitted for a day or two, and discharged, you de-isolate after 10 days, after testing positive. But for those who are still in hospital, that will be the responsibility of their doctor to discharge them and give them excuse duty based on how long they think they are fit to renew normal duties. For those who are high or moderate risk exposure to someone infected with COVID, that's another one. People were taking 2 weeks because he's a contact. If you stay home or self-quarantine for 5 days after the last exposure, that's the policy. So now you do 5 days at home. That is if you test negative, because we tested along the way, you stay 5 days. But if you do test positive, you go back 7 days, just like those who are exposed 7 days after you test positive, after the last exposure. So you were exposed, along the way we tested, you were positive, your 7 days ends the 7 days from your last exposure to the person who had the issue, who was positive. The booster also policy has been approved, as was announced by the minister. We don't just look at it. We have a National Immunization Technical Advisory Committee who looks at international and local data and come up with the recommendations for ministers' approval. Based on that, booster will be offered to all health workers. Will be given booster. And the booster is 3 to 6 months after your last vaccination. So that means that if you had your last dose, say in March, you'll be eligible for a booster dose between 3 to 6 months. Not immediately you've had that. And so that will affect all health workers, persons with underlying medical conditions such as diabetes, hypertension, persons 60 years and above, frontline security personnel, and members of the executive, judiciary, and legislature. It actually mirrors the initial prioritization that was done. Pregnant women who are unvaccinated will now be can now be vaccinated. Previously, it was not policy to vaccinate them. Now they can be vaccinated. And they are recommending that we use either Moderna or Pfizer, which is the mRNA technology, to vaccinate them. The minister had mentioned areas of the mandate already. I think the group that still exists, as was mentioned earlier, is all health workers, students, secondary school, frontline, security personnel, and commercial drivers. But I think further consultation is going on, and once the minister is convinced as to those who fall, the persons and the venues that will be chosen, and the date will start, that will be announced. But this is just to let you know these are the possibilities of people who are likely to be captured in the current mandate. So that will be after the consultation. The list may change or may shrink or may expand, depending on the situation as we find ourselves. Honorable Minister and friends, so our outlook is that our current fourth wave is being associated with significant increase in number of cases, and I think we're all aware around that. Despite the low proportion of severe and critical cases, evidence of high proportion of such cases are being unvaccinated is a source of concern. So what we have also noticed is that the numbers were high, but for the people who fell ill, who were mostly infected, were the people who were unvaccinated. The current downward trend is expected to continue with the intensification of efforts of maintaining protocols and vaccination. In Ghana, as soon as the numbers start rising, people start wearing their mask. I hope that they will continue wearing their masks even when the numbers are down. But you never know when it's going to start going up. So as the problem got bigger, people started wearing their masks, washing their hands and avoiding crowds. It has helped us to do a very steep reduction. Let's keep it up. Additional measures implemented are likely to help drive the further cases down, like some of the airport policies, etc., will help us bring the cases further down. And we must all make concerted effort to ensure that the fourth wave is flattened by all the things we do, vaccination and adhering to the protocols. Thank you very much.
Thank you, DG, for the insightful presentation. Ladies and gentlemen, as you heard from the Honorable Minister and the Director General, if you are eligible to take the booster shots, please, it will serve you and our country well. Do well to take the shots. So I'll now call on colleagues to show by hand. If you have any question, we'll bring the microphone to you for you to ask your question. If you have any submission or anything at all, kindly let us know your name, the media house you represent, and then proceed to ask your question. Okay, I can see one hand from the back. So we'll take 1, 2, 3, okay, 4. Okay, so let's start from behind, and then we'll take the 2 on the left wing and then come to the side. So please, your name, media house, and then you can ask your question.
Okay, my name is Sarah Paku, and I'm reporting for Media General. I have a few questions, but since we'd have rounds, I'll make it quick with the first round. I would like to find out when the new directives at the airports would take effect. Is it immediate? I didn't get the date. And the vaccination of the pregnant women, what is the assurance that the baby would be protected as well as the mother? What informed the decision specifically? And I also want to find out how close are we with plans towards the local production of vaccines in the country? Thank you.
Okay, thanks for the question. So we'll take the second one.
Right. My name is Obed King. I report for GH1 Television. I want to find out from the minister.
Onyima eyana osuro se bibi beye ne baninti nhihye ben na Ministry of Health ene apumdia so indigo akwan mu se ne beye betimi ni apemfo ne be kasa ye no ate ase se vaccine ya mi we enya de ba koye me ba no boni anase me kra na me ye opemfo no enya de a bibi ebetimi aye me anase me ba na na afen so education ebe ko nkrenkra na se any the remote areas and ebaya opinfo bi owo ofansia yebi anase bi anyame bekyere no obeti asiese se me wo vaccine na enyame nko na ebo me ho ban nemu me ban so medase
that's it. So we'll take the last question from the back and then go to Honorable Minister and Director General.
Minister, good afternoon. Your friend is Sami JC from Accra FM. Pacho, the question is, Nancy, it could be Babonte and I want to move say from concerned doctors. I know more kiki against mandatory vaccination. No, you be Ghana Health Service or more reaction is saying, and I face to boom. Ghana Health Service bet me am my nipa dodoa asat na omo etumi vaccinate omo e Ghana ha medase.
You. Okay, so that's it for the first round. So we'll go to Director General for responses now. Okay, so let's start with Honorable Minister, and then we can excuse him and come to that.
Thank you very much. I think I'll pick just one question, and after that, I'll beg to leave to launch do some other activity. I'll pick how close are we with the local production of vaccines? We are getting closer. As I speak, we are partnering with some German scientists. They visited once. They are currently even in town and having some discussions with the vaccine committee. Government set up a vaccine development and a committee that has worked so hard. They finished the policy. We have actually pushed the policy into a bill that has been sent to the Attorney General's office, awaiting it to go back to Cabinet for it to go to Parliament for enactment. And after that, we were working on these things. They have started putting up a building for the Vaccine Institute that will do a lot of research and development. And then they've selected companies that will join with the Germans to do the vaccine, what we call the finish and fail, properly in country. We are getting very close, but I can't give exact deadlines to this thing. It won't be that long. More details will come, and when we are getting even closer, we will look at that. I think I'll leave the rest for the Director General, and I'm pleading that you allow me to go to launch some other global standards in some of the health issues that we are tackling. I thank you so much, Deputy Minister.
Thank you very much. The first question was about the new directive to the airport. When does it become effective? I would say effective, as we've just mentioned, but always the airport requires time to educate, engage the airline operators to get clearance, to give them their full instructions, and also they also have to reach their other counterparts from other parts of the world, and that will be the time that they will need to ask and maybe give us some 48 hours to be able to make effective on the website and make sure that people who need to know about the new directive so it doesn't create any confusion. Otherwise, once it's announced, that is the new policy. Pregnant women, we've done quite a lot of work. We, as Ghana Health and all the other agencies who are working with us, we are all concerned about pregnant women. That's why we didn't add them in the first place, in the first 1 year of implementation. But now that we have enough evidence, both international and local, we are now able to add pregnant women to it because it's effective and safe. There are studies in Ghana we are collaborating, which we are even looking at effect on breastfeeding and etc. And so far, it is safe, and that is why we are adding that to that. And then they've also recommended specific vaccines that can be used for pregnant women, just like we have specific one for 15-year-olds, those below 18 and 15. The vaccine mandate, I think the minister had mentioned, responded to the vaccine production. The vaccine mandate in court. As we speak now, I don't think we have any case in court. That's my information. And that's with the Attorney General. But as we speak today, we do not have any case of any challenge in court. What are the measures we are putting in place to increase those who are fully vaccinated? Remember that the first dose and the second dose, there's a time lapse. AstraZeneca can be as long as 8 to 12 weeks. That's almost 2 to 3 months. And so always the fully vaccinated is going to lag behind the second dose. But you are right, we are encouraging those who have unduly delayed to come back and take their second dose. But remember, our original policy was to give enough protection to as many people as possible. So there's a push to ensure at least everybody has some immunity, which protected you for a couple of months before you got the second dose. So now that vaccines are available, we are encouraging everybody to come at the right time and get their second doses. On the pregnant woman, I think the question was asked in Chi, so I will also try and speak to the same community. Nyamika is a pregnant apem no. You start here near him say, and I'm saying say a safe and as effective or ama or money or mumbano. Ya informa nka ho. Na baby edru ne him say information or hananya Ghana kwan kronkro bebre wo ho a o mafra se ebo vaccinate apem for entina yaye studies yaye wo amano ne ene kakran se ebo Ghana kire se safe ya hwa even se wo wi kra ni no for no kra na effect be na wo ni nyina kire se ya so hunu so se pregnant women na no fa etimu emse ba akokra de study ba akode be 20% amunya bi no e no mu free mu enti no apart from say safe no onyema the risk no so e wo soro pa enti na edi mu aka ho ye be ni on be kasa ye ni senior education radio so TV so ye friend community engagement you go hu him for you hu assemblyman ye uko in class Ghana has a vinyan krankwa o ye wo kra bia so Ghana enti omo ne obia kasa church omo se be ya omo hunu se o de bo apemfo a safe na wo so bon so a safe eno na ade a ye beto so ade aye concerned doctors there have been two approaches. I think as soon as they came out, Ghana Health Service is the Ghana Medical Association, the body of all the doctors in this country who responded and just made sure that told them that what they are doing is inaccurate, is not correct, and that we have also come up with our own statement in various forms to look at the fact that some of the information they are giving are inaccurate, is not correct, and some of them are even vaccinated, I must add. Some of the people who signed, they are vaccinated. You know, so, and we are one of our also responses that when you are looking at a scientific paper, you look at it, those for you and those against you. You don't cite those that suits you and leave all the others. And then I think we've always had people who have had issues with vaccination. We are continuing to engage them and also engage them to ensure that they also are in line with the government policy, especially where they are also government workers. So that's our situation, and that we are actually in there. We're also giving you data from Ghana East, where they quoted. to show you the real data for the month, to see what is really happening, and not picking one day and sort of muddying the waters with that. So that has been our concern. As for the total number of people vaccinated, I think we mentioned it so far. We have a little over 9 million people have at least received the dose. And that's what translates into the 34% proportion that we gave you. Thank you very much.
Thank you, Dr. Patrickuma Abuaji. Please, if there are any questions, we'll take the last set of questions. If not, okay. So we'll take 1, 2, and 3 at the back, and that will be there. And so if you have any question, this is the last round. Kindly show by hand and then ask your question. Okay, so we'll take 2 from the right wing and then go for the last question at the back. Please.
All right, thank you very much, Honorable. Good afternoon, Mr. Director General. My name is Enes Jamra Akowachum from Adum FM. I want to know, just for the purpose of